hand versus chainsaw. It looks painful.
Our hospitals are taking care of more patients than ever.
You're right.
With medical teams under constant pressure.
Can Dr. Pixie come to resource, please?
Somebody as poorly as this little one, we really need to treat them quickly.
To meet our expectations.
I'm just worried about what it's going to be like afterwards.
But there's a crucial member of the team we sometimes forget.
I've never ever been on a bed like this.
The hospital bed.
Another ward, another storage, another bed.
In our lifetime, we are likely to need one of them at least 3 times.
I've probably spent a quarter of my life on a hospital bed.
In this series, our cameras have been given unprecedented access to beds in 4 very different hospitals across the country.
It's life and death and everything that goes in between.
We'll see the world through the bed's eyes.
Hello, my love. Hiya.
As they share the most challenging,
I don't know what to do. I don't know.
most intimate, and most rewarding
In hospital, wonderful.
moments of our lives.
Thank you for being here.
Have you been anywhere else?
And a hospital cannot function without beds. Beds are vital.
This is The Secret Life of the Hospital Bed. At Birmingham's Queen Elizabeth Hospital, the day surgery unit sees a high proportion of elderly patients.
Bed 43 and we'll be going home in about 20 minutes if we still need the bed.
Yes, I do, yeah.
Here, more than 80 beds work hard dealing with up to 2 patients each day. Today, bed 23 is ready for retired builder, 73-year-old Peter. He's having a biopsy to see if his prostate cancer has spread to his bladder.
It's ready to collapse. Must be the hunger.
It's got to be the hunger. You normally had about 10 spuds by now, haven't you?
Daughter Wendy is with him.
He's absolutely scared, Steve.
Not that scared. I'm a bit scared, but I'll be just glad to see the end of it.
Yeah.
Advances in medical science mean more people are surviving cancer than ever before. Peter's prostate cancer is being treated with drugs.
I'm in and out of hospital every second day.
You should have a loyalty card for
I
it.
know. They should keep me in.
They should give us free parking by now, crikey. The amount we've spent.
Peter's checking into bed 23 at 12 noon, with his operation due to take place this afternoon.
More hungry now than ever.
I know.
Under anaesthetic, there's a risk of being sick if you've had food or drink, so he's been nil by mouth.
Well, I'll be dead with the hunger if they don't hurry up.
Smelling that food coming through was like that.
Oh, that was
God.
a killer.
Oh my God. Yeah. Starving though, ain't you? He's had his breakfast at 7 o'clock and normally having his lunch now, ain't you?
I'd have me bite of bacon and cabbage.
He's worried about the operation and everything like that, but he won't let you know that he's worried about it because he doesn't want you to worry about it.
Here's my stomach.
It's crumbling, isn't it?
It's rumbling. It's telling me I need food.
He's got prostate cancer. He's got cancer of the bones. And now this, worst case scenario is that it's going to be another form of cancer that he's got to deal with.
Hello.
How are you?
How are you? I'm fine. How are you?
I'm all right, thank you.
I'm one of the staff nurse. Nice to meet you.
And you?
Staff nurse Shawega has worked on the ward for 3 years.
What do you prefer to be called?
Peter.
Peter or Mr. P?
No.
Can you confirm your date of birth for me, please?
The 11th of the 6:43. Now I'm 73.
Oh, you look young. What's the secret?
20 Guinness. And bacon and cabbage.
He's a bit of a joker. It's his way of dealing with things, is to make a big joke of it just so that it gets him through it, you know.
Any history of anxiety or depression?
Oh, I get depressed.
Are you on medication for that?
No, all I need is a woman. But the one...
Don't know where to put myself, you know.
Oh, God.
I'm gonna go and sit in the toilet for a minute.
It's a shame we cannot prescribe that.
In the NHS, yeah. Here's a woman now. She's coming down to you in a bit.
Do you smoke or drink alcohol?
I drink a lot of Guinness, but I don't smoke.
So how many cans do you have in a week?
Up to 160.
No. Is that... Are you kidding me?
No.
No.
I told my GP, and he dropped the pin up it.
It's a lot.
No, he did not.
Okay.
He does drink a lot of it, though.
Change that depression, because it's that.
Nice to meet you.
It's lovely to meet you.
Nice to meet you, sir.
Yeah.
If you need anything, just give me a shout. I'm outside.
Yeah.
Okay.
All right, thanks very much.
Feel free to be at home. Feel at home. But feel at home, but no Guinness.
All right,
We know
all
what's
right,
going on.
thanks.
Yeah, bye.
Thank you.
Bye. Love. Thought I'd be out by now.
No, it's only 25 past 1.
Yeah, that's an hour and a half. And they haven't even started yet.
I know. But you're on the list.
I know I'm on the list, but how far down am I?
Do you really drink that amount? Terrible. It's a wonder you're still standing.
And my kidneys are all right, my liver. All them are all right when they tested me.
It's pretty good. He does like the odd Guinness, and that's his way of dealing with the pain and the idea that he has got cancer and it might not be something that they can cure. His drinking is a big worry because we don't think his tablets work when he drinks to excess. But at the end of the day, he's a 73-year-old man. I'm not going to stop him, you know, at the end of the day. It's what he wants to do, and it makes him happy. So we just let him carry on with it.
Day surgery bed 23 will take Peter to theatre for his biopsy operation later this afternoon. For now, it's a waiting game. The city of Newcastle has over 20,000 primary school children. If they have an accident, many of them head to the Great North Children's Hospital.
I'm going to start by looking down from the top of your head.
Just relax it like jelly.
Just tell me if I press anywhere that's sore or...
No.
Young boys are more likely to attend A&E than girls, with 2/3 of them breaking a bone in their body before their 15th birthday.
Yep, you're all finished.
9-year-old Sonny has a suspected broken finger after trying to save a ball at a football match. Paediatric bed 27 is ready to see Sonny and his mum Julie.
Hello, is this Sonny?
It is,
Hello,
yeah.
I'm Becky, I'm one of the nurse practitioners here. Are you Sonny's mum?
I am.
Hello, nice to meet you both.
Nurse practitioner Ramshaw has been part of the paediatric team in Newcastle for 3 years.
What have you been up to?
Well, I've been playing football and I was trying to catch a ball and then it hit my finger.
Right.
And then my finger bent back.
Bent right back over. Would you like some medicine to help with the pain?
Yeah.
Yeah? Is there a cut or anything there, is there? Or is that just there to... just likes it on. Let's have a little look. So, can you point to where it's sore?
Round about there and...
Okay. Can you feel me tickling your finger?
Yeah.
Yeah? Does it feel the same as when I tickle that finger? Yeah. Okay. Tell me if I press anywhere that's sore. So is the rest of your fingers all right?
Yeah.
Yeah? These ones are all okay up here?
Yeah.
And what about here?
Fine. It's there.
It's there, that's sore. Okay, so I think what we need to do is get a little x-ray. Alright, so he is quite bruised and swollen over the joint space, so he may have done, from that injury, he might have done a little chip fracture, okay? So we usually suggest that you don't do any sort of sports that might cause any further damage or injury. You got stuff planned?
Yeah.
What have you got planned?
Football.
When on the weekend?
Saturday.
Okay.
Big tournament, isn't it?
Oh, really? Alright, okay. So we'll give you some pain relief and then send you the x-ray, and then obviously once he's back, have a little look at the x-ray. Okay. See you soon, Sonny.
Bye.
Bye.
brave boy, aren't you?
I don't know.
You what?
At the moment, we've got lots of minor injury stuff coming in because it's quite nice weather and children are obviously off school, so they're out and about, they're more active. So yeah, we've got a lot of injury stuff at the moment.
With a football tournament at the weekend, 9-year-old Sonny's suspected broken finger may stop him from competing.
What are you going to do tomorrow? Do you think you'll still be able to go?
I want to go.
Yeah.
I think I will.
Definitely no kicking the ball and catching it.
I'm not using my legs.
Yeah, well, you're not going to be able to do rugby if it hasn't got better, are you?
It will.
The results of the X-ray will decide his finger's fate. Newcastle is the most densely populated city in the northeast of England. So it's no surprise that at times its Royal Victoria Infirmary can be inundated with patients. Today, the A&E department is under pressure. The consultant in charge of A&E is Mr. Connolly.
We had a fairly significant peak where we were almost booking in one person a minute for about an hour. So we're catching up.
Over the last 6 months, 37-year-old Kenza has been rapidly losing the use of his right arm and leg. It's affecting his ability to be an active dad with his 3-year-old son.
My grip on my right arm is about 1 out of 10, so I can't even hold a bottle and open it.
Kenza's come to A&E with wife Dawn.
Last 24 hours has been quite bad, and the pain was quite extortionate, so I was asked to come here.
When they come in on his own accord, so I told me how to.
Following the wife's instructions.
A&E waiting times are on the rise. The aim is to treat every patient within 4 hours of being admitted. After 2 hours in the waiting room, Kenza finally meets A&E bed 9. He's assessed by Dr. Hayes.
It's quite comfy.
First time I've heard anyone say that about our trolleys.
It's quite comfy. Might be because I've not slept much. I'm going, oh, bed.
Can you just squeeze my fingers on both sides? Squeeze, squeeze, squeeze. So you're quite a lot weaker on that side, aren't you? That's
my main arm.
Outstanding. Just have a look at the power in your legs. So just push this leg up for me. Push my hand up. Good. And this leg. Good. You've got a little bit of weakness in this leg as well. And you say that's new to
That's
you.
new, yeah.
All right.
9 months ago, Kenza was rushed into A&E with a suspected stroke. He'd lost sensation in his right arm. He was later diagnosed with a bulging vertebrae disc in his neck.
Because this is quite a long-standing problem, I need to just go and have a look at any previous scans and see what's been done and also what's been thought as well before. So you have clinic letters. All right, so I'll be back with you in a bit.
No problem.
Right.
Yeah, fine.
Okay. Thank you.
We didn't want them to check your leg, and now they've checked your leg.
But I just feel like I'm wasting people's time. That's why I don't come in.
Dr. Hayes is reviewing Kenza's medical notes.
I'm just wondering whether this gentleman's disc bulge in his neck has worsened over the last couple of months. He's got clear evidence from before of disc bulge, and he's just describing symptoms in his lower limb now.
Kenza is currently managing to hold down an office job. As a father of 3 children, he's concerned about the future.
That's my main worry, is it affecting us as a family? As long as it doesn't affect the little man. 3 years old, loads of energy, loves football. I still try and do something with him, but sometimes I can't because I'm in that much pain. I just want to sit down and relax and not move. Give little man a ring at 5. He's got to go for his McDonald's. Promised him one.
Kenza needs to be discharged within the hour if he's to take his son out to dinner.
Hi there.
Hi.
Right. I've had a talk with the neurosurgical registrar. He said, yes, it would be a good idea to get another MRI. I know you've had one recently.
Right.
But with the change in symptoms and the change in particular sort of developing leg problems, if it's starting to affect your walking, we ought to be just looking to see whether that disc bulge, that disc prolapse that you've got, is getting any bigger or not, and whether it's pressing on the spinal cord. The one thing I will say straight off the bat, I'm afraid, is it's potentially going to be a fairly long process. So I wouldn't expect to be leaving here in the next hour or so, or having had it done. It may well be that we end up referring you back to the neurosurgeons, and they might well change their plan. I'll see you shortly.
No problem, thank you.
Kenza will stay with bed 9 until his MRI scan later. Day surgery bed 23 at the Birmingham Queen Elizabeth Hospital has played host to Peter for over 2 hours now. He's been waiting to go to theatre to see if he has cancer in his bladder.
I get frustrated waiting too long. 2 o'clock.
It's 20 to 3.
This is a joke.
Oh, God. Tiring, all this waiting around.
Another hour passes in bed 23 when Ward's sister Davis comes to speak to Peter about his planned operation.
Hello there.
Hello. Hello.
I'm really sorry, but the theatres have just rung me to say that they need to cancel you today. They've run out of time to do the operation. All right. So what we're proposing to do is send you home today.
I don't want to go home now.
No, he's having you on. He's having you on, don't worry.
It is always a last resort when we cancel patients. It's a really long day for the patients, especially if they've had to be nil by mouth. And obviously the longer they wait, the more tired, frustrated, dehydrated they get.
Last year, less than 1% of all surgeries were cancelled at the last minute.
That's lovely.
Unfortunately, Peter is one of the unlucky few.
I can't make it tomorrow, so he's going to have to, unfortunately, come in on his own. OK, go on in. I can't have another day off work, unfortunately. Thanks very much. Are you on tomorrow? Oh, who's he got tomorrow? Oh, your legs are killing you, aren't they?
A bit disappointed that I waited so long, but there's nothing we can do about it, like.
If there's an emergency, there's an emergency.
Yeah,
There's nothing you can do.
I could have a lot of exercise.
So Peter will return tomorrow.
See you tomorrow.
See you later.
In the hope that his bladder biopsy will finally go ahead. Back on bed 27 of the Great North Children's Hospital, 9-year-old Sonny has a suspected broken finger. But it's not his first fracture.
We have been in this bed before, haven't you?
The first time I broke my leg, I was on a climbing frame and I flipped over and I put my leg out and like straight and then it like broke. The second time was my arm at a caravan site, and in France I accidentally ran into a glass door.
You didn't break the door though, did you?
I didn't break the door, but I broke my cheek. And I think that was it.
You did your toes somewhere.
Oh yeah, I was.
But we think that one was.
And my toe got caught, and then my toe snapped.
You broke your leg. You're in Scotland though. And when you broke your arm,
I was in.
Walkway.
Broke my nose. I was in Italy. Broke my cheek. I was in France.
Maybe we shouldn't go on holiday.
I'm supposed to be going to a meditation thing.
What's that?
Like how to relax. Need it, having you and your brother, don't I? You've been to hospital to visit anybody else, or has it always just been when you've come in?
Hello. Hello.
Nurse Cowper arrives with some pain relief.
Yeah, we're going to do it all in one. Perfect. All right, we can go for your x-ray now. We'll get a picture taken of that finger.
Less than an hour after being admitted, Sonny is off to X-ray.
You put your hand flat on there like that for me. There we go. You just keep nice and still for me for 2 ticks. Magic, we're all done.
Great, thank you.
Sonny has an important football tournament this weekend. A broken finger would stop him from playing. Bed 27 will stay by his side until the results are through.
You can get back on your bed. Your bed.
His X-ray results will be reviewed by a specialist within the hour. At Newcastle's Royal Victoria Infirmary, A&E Bed 9 has a job to do. After an hour with Kenza, the bed's now taken him for an MRI scan.
Have someone to chat to you? Yeah?
We've been pushed up and I've been walking.
The neurosurgical team wants to see if a bulging disc in his neck is causing the severe weakening of the right side of his body.
You having a sleep?
No.
Did you just nearly not off there?
No, it's comfy.
1 in 5 men don't go to the doctor due to fear of time wasting. Wife Dawn insisted that her husband came to A&E today.
I'm happy that he's come in and actually listened. And they've been quite quick in getting sort of sorted out. Ken's quite stubborn when it comes to stuff with him. He always puts everyone else first. The kids, and then me, and then himself.
Alright. Okay,
Bye.
won't be long. We'll take about 10 minutes or so this one, alright?
Bye. I won't sit around it. He'll be alright. He always is.
You okay there? Lovely, we'll start now.
I think his situation will get sorted. Which way it's sorted, I don't know, but if he has to put up with it or they need surgery or something, they'll find a way to fix it. Hopefully.
So easy, you think? It's not get chase immediately.
I would gather, I think it was 60s, 70s music.
It was that 70s.
Was it? There, see? Oh, look, a picture of flares.
Picture the nightclub.
Oh, yeah.
It's 2.5 hours since Kenza was admitted to A&E Bed 9.
Here you go, buddy.
Right, so I've still got no reports actually for the scan. Right. However, the neurosurgeons themselves look at these scans a lot, so I've just phoned him. We want to get things sorted and clearly worried enough to come to hospital today. Then he suggested that we admit you to the ward, to his wards, and he will have a look at you up on the ward when he's finished with this operation.
Right.
We'll get that arranged then. We'll get you up to the ward where it's more comfortable. Well aware that you love our trolleys.
Cool.
Okay.
Yep, fine.
All right.
Thank you very much. Alright, I'll get to his ward. Oh, great.
Before he's transferred to the neurosurgical ward, there's one thing he wants to do.
2 seconds.
When we go now. Hello, little man. Alright, shall I say night-night then? Night-night, be good for Nan and go to nursery like a big boy tomorrow, okay? Okay, love you. Again, it's a little bit scary because it's why I've been admitted, but I'm in the right place, so they're obviously a little bit concerned. But even if it's not surgery, at least there'll be a plan in place to get around it. Relieved to be here now. Wait for the surgeon, see what goes on, see what he says, and then go from there. And then hopefully get a resolution.
With Kenza moved on to a new ward, Bed 9 can return to the A&E unit for its next patient. Back in Newcastle's Great North Children's Hospital, 9-year-old Sonny and mum Julie are waiting for the results from the X-ray of his suspected broken finger.
Do you think we're going to be okay? Do you think it's going to be all right?
Yeah.
Do you think?
Yeah.
Why?
So I don't get to miss the football tournament.
Oh, it's so important, isn't it?
Yeah.
I know, darling. We'll see.
Next Saturday.
It's this Saturday.
Is it?
Uh-huh. Exactly. Stick to kicking the ball, not catching it, eh?
Hello, how are you doing?
Good, thank you.
Okay, sweetheart, so I've got your x-rays back and we've had a little look at it, okay? And it doesn't look like there's any obvious fracture there, so that's good. But it is quite sore, so what we would do is a buddy strap. Have you heard of that before? Have you had one of those before?
When you strap them together?
Yeah. My advice is that we leave that in place over the weekend and it should start to settle down. And yeah, you have to be sensible about it. So if it's really sore and you play a game and you hurt your finger again, then you may cause more damage. That's the only thing. Then you'll be out of sports for longer.
Mm-hmm.
So our advice is that you rest it, because if you rest it properly, then it has time to heal. Okay?
Yeah.
Okay. We'll get it from here. All right. Not be long. So if the injury's not looked after properly, what can sometimes happen is it just takes longer to heal, so it just rattles on for a bit longer. If we hadn't done an x-ray and there was quite a nasty fracture there, then it would have taken a long time to heal, and quite possibly you would have ended up with a finger that looked a bit different to the others. I think the only problem with Sonny, bless him, was that he just wanted to play football at the weekend. And obviously I've been the bearer of bad news.
What do you think?
I don't know. It might feel better tomorrow because, like, sleep and it'll rest then.
Maybe.
Depends if it hurts.
Yeah. You'll have to be careful tomorrow, I think, definitely.
Yeah.
And then Saturday, we'll see.
Yep.
Mm-hmm.
Hopefully.
Hopefully, I know.
Hello.
Hi.
Right, we're going to pop a little dressing on that finger, is that all right?
Yep.
Sonny's fingers are dressed with a buddy strap, leaving paediatric bed 27 to be prepped for its next young patient of the day.
Thank you. Or yours. You can get yourself home.
Thank you very much.
Get them legs and everything washed up there.
Yeah, the whole lot washed, I think.
Well, I've just got a buddy strap on my 2 fingers. And it's really comfy on my fingers.
Feels much better. We've got lots of medicine, haven't we, to help you feel better?
We're going to be resting my finger.
Mm-hmm. If we rest it lots,
yeah,
hopefully it's okay for Saturday. I am so happy now. I didn't want it to be broken, obviously. I don't want my little boy in pain, so it's good news, isn't it? Really good news.
In Birmingham, at the Queen Elizabeth Hospital Day Surgery, 73-year-old Peter has returned for a biopsy on his bladder to see if his cancer has spread. It should have happened yesterday, but the operation was cancelled due to a number of emergencies.
Hello, I'm back again.
How are you?
Not too bad.
Yesterday, Peter spent 4 hours waiting on bed 23, but he's hoping everything will go smoothly today.
Peter Hessian.
That's me.
Hello, Peter.
Hello.
I'm Rachel. I'm one of the nurses looking after you. How are you doing?
Not too bad.
Okay, so this is just this way.
He's in bed 41 today, and Nurse Lloyd starts his pre-op checks.
We're cancelled at 5 o'clock. Did you go home and eat plenty?
I just had the pork pie and a pint of milk.
Is that all you had?
I'm not a very big eater, like.
Yeah. You starved you 2 days in a row now.
I have my own bacon and cabbage. It's good.
Very nice. Yep, blood pressure's perfect. 142 over 83.
Thank you very much. That's what I like to hear.
Nurse Lloyd is one of the team looking after Peter today. She's been qualified for a year.
I was never somebody who really wanted to be a nurse right from a really young age, but it just kind of clicked.
So I need to get you a wristband. Oh, is this your one from yesterday?
That's the one.
As long as you haven't changed it, you're still Peter Hessian, yeah?
Yeah.
Perfect.
I didn't change my name.
I did a little care work in an elderly care home and I loved it. So I thought if I can do that, I can do any type of nursing. So that's why I applied.
Keep me smiling.
We will.
All right.
Okay.
Yeah.
You try and make it as nice as possible for them because I know nobody wants to be in hospital. A lot of the time people are nervous, they don't want to be here. So we try and have a little laugh and a joke where possible.
I gave theatres a call. They know that you're here. I think you are third on the list, so maybe a little bit of a wait, but hopefully not as much as yesterday.
3 o'clock.
No, third on the list.
Yeah, but it's 1 now, so that'll be about 3 o'clock.
I don't know. Depends how long the cases are before. Okay. Hopefully not too long. All right.
Consultant urologist Mr. Doherty is one of the UK's most renowned prostate cancer specialists.
You're here this afternoon to have an inspection of your bladder.
Yeah.
Is that how you understand it?
Yeah.
And I believe one of my registrars had a look with a flexible telescope some time ago, a few weeks ago.
Yeah.
Saw a red patch.
Yeah.
And that's what we're going to look at today.
Yeah.
The advantage of you being asleep is that we can take a biopsy of that red patch if it still looks red and if it looks suspicious.
Yeah.
Good. All right, so I've just got to get you to sign the consent form. It says that you're going to have what's called a cystoscopy, which is a look inside the bladder.
Yeah.
Plus or minus bladder biopsy. I don't plan to do anything else. The benefits are really diagnosis of if there is any problem there, and the risks are that you might get a bit of bleeding and it might sting a bit when you first pass urine.
Yeah.
If you can just sign where it says patient signature here. Right, I think they're here to take you upstairs, and this procedure I think will take about 10 minutes. Once you're asleep, once we've positioned you, so it shouldn't be too long. Quite a quick one.
10 minutes?
10 minutes, is that too much?
Oh, no.
Okay, good. I'll see you shortly.
Thanks very much.
2:15, and earlier than he expected, bed 41 takes Peter to theatre.
Patients literally go everywhere on the bed. They literally travel miles a day. They see so much. Most day case procedures, they'll come to their bed in the morning, they'll go on that bed, they'll go up to theatres, they'll come back to us on the same bed, and they'll be discharged from that bed. They always stay with that bed throughout the whole procedure, so I think that's quite nice.
Peter's currently being treated for prostate cancer. Today, he's having a bladder biopsy to check that the cancer hasn't spread.
It's a massive thing to go through emotionally. Generally speaking, it's a bit of, oh my God, you know, that's going to change my lifestyle. My days are numbered. Part of our job as consultants is to explain to the patient that it doesn't necessarily mean that they're going to die rapidly or something, but they are likely to need treatments to control it. And sometimes we can even cure people of cancer.
Peter will get the results of his biopsy as soon as he gets back to the day surgery ward. The paediatric A&E unit at the Great North Children's Hospital has 9 beds. With so few beds, there's always pressure to make sure that they're available for patients who need them most.
She just had a simple knock on the wall and twisted. 15.
Nurse Ainsley is in charge of the paediatric A&E unit today.
We need to be able to filter out what's a simple injury to the more complex patients that need to be seen urgently.
This is paediatric A&E bed 27. Its next patient is 11-year-old Nissi. She's been brought in by her mum Sharon
Just stand on there for me, please.
with a lump on her elbow after banging it on a metal table at school.
We were matching it up to see the swelling, the difference, and it is quite swollen up. But obviously, my perspective will be different to a doctor's perspective. I'd rather get it checked out to see exactly what's. I don't like leaving things, because it can get worse.
You sit your bum back here. Have a sit back. Sit back and relax. Right, let's have a look. Whereabouts does it hurt? Do you want to...
I'm feeling it on my... Yeah, it's got like a massive, a bit swelling on my lung.
There is a little bit difference. You can see where it's more pointier. And then you got this part is quite swollen.
But it mainly hurts like around here.
But you can move it up and down like that.
Yeah, but it's
With
a bit
pain,
sore.
yeah.
We do see a lot of injuries similar to Nissi's, elbows, knees, heads that come straight from schools. These do cause a lot of big pressure on ourselves to see simple injuries that could be managed at home a lot of the time.
Last year, around 13% of people who attended A&E were discharged without requiring emergency treatment. Nissi seriously damaged her elbow when she was just 2.
Was it?
And Mum Sharon is concerned the knock has aggravated the old injury.
Are you comfortable lying back? You look like you're not... It doesn't look very comfortable, is it?
It is.
Is it?
I'm getting really warm now.
Because it's warm in here, that's why.
I don't think it's that major, but I think I've just like hurt a bone or something. I know.
And how are your arms now? So
It's there mainly.
it will, because you just hurt your arm. It's metal. It's metal. It's white, and the bone. I just don't think why it takes so long to.
I've got loads of patients to see.
Hello. Hi, sorry.
Nurse practitioner Ainsley arrives to assess Nisa's elbow.
Let's have a look at both your arms. So roll this sleeve up as well and
Do you want me
pop
to
your
move
arms
across?
out like that. And then bring your arms up like that for me. Bring them all the way up. Touch your shoulders. Excellent. And then straighten it back out again. Both sides.
Both sides, Nissi.
Perfect. Okay, just relax. Fine. I think it's just a nasty bump, Mum.
Is it?
Yeah, I mean, there's nothing obvious to find on it, I would
Okay,
say. That it's probably just a bit of a bump. Give her some paracetamol over the next
Okay.
few days. She's got good range of movement and all
Okay.
that. She's moving it quite
Okay.
freely. I would just pop her back in 48 hours, 72 hours if you're still concerned.
Concerned, but then
otherwise-
it's swelling or anything that can.
Yeah,
you
just keep an eye. But otherwise, I would just say it looks
Yeah,
fine.
just because that's main thing is to make sure there's no like obviously ligaments damaged. We're just checking it. Fine. You want to get your shoes on, sweetheart?
That wasn't that loud at all, was it?
It's all right. There you go.
I better put the bit out.
Obviously, I'm feeling much better. Obviously, after what they told me. So if it was a major thing, then obviously I would be worried, and they would have kept her in. But they have given me my peace of mind of rest.
Nissi heads home, and paediatric bed 27 is freed up for its next patient. Back at the Queen Elizabeth Hospital in Birmingham, 73-year-old Peter is having a biopsy on his bladder to see if his prostate cancer has spread. Consultant Mr. Doherty has just completed the procedure.
So we've just finished looking inside his bladder, and we're very pleased that there's nothing dangerous there. I think he'll be pleased to know that there's nothing more serious.
The cancer hasn't spread any further.
He's a character. He seems to be very accepting of the diagnosis and gets on with it. He takes his treatment on the chin, so to speak. He's responding well to treatment, and hence why he's in good spirits.
The day surgery unit closes at 8 o'clock. At the end of his second day, bed 41 transports Peter to a ward to recover.
So once you've eaten, drank and got moved around, we can look to discharge you still.
I feel 100%. Just raring to go. I could get up and walk if I was allowed to. Just glad it's over. I'll be glad when I get home.
Daughter Wendy arrives to take Peter home. But he can't be released until he's gone to the toilet.
Can I go to the toilet? You just feel it's coming like, but it doesn't, and you just...
Shocking. Shocking. but you need to drink a bit more, and then hopefully
Give them a sample and I can walk out the door.
you just need to make sure everything's working properly before we leave.
It's probably messed up my sex life now.
What's that then?
If he doesn't manage to go soon, Peter may need medical intervention.
If you can't pee in the next half an hour or so, we may have to catheterise you, but we'll speak to the doctor about that.
Is there any chance somebody will go out and get me 3 pints of Guinness?
So the closest thing we've got is probably alcohol gel. So.
Only joke. Thanks.
Up to 70% of patients have trouble going to the loo after surgery.
I'll have another drop of water. It seemed I was in there an hour. It's coming, but it's not coming out.
30 minutes go by.
Just wants to go home at the end of the day. So he's just really fed up.
Peter returns. No success.
I've not been.
Okay, so we'll keep you overnight.
Oh, I've been, but I forgot to save it.
No, you didn't.
You're trying. You all dressed up to go home as well?
Yeah.
Give us a hug.
Aye.
Give us a hug.
Yeah.
All right?
All right.
I'll see you in the morning.
Yeah.
Yeah?
All right.
All right?
See what happens.
All right.
Ta-ra.
All right, see you later.
Ta-ra.
Ta-ra.
Delighted. But I won't be delighted as much till I see the back of the door.
Peter managed to go to the toilet during the night. He can finally go home.
All right.
All the best, take care.
Okay.
Bye.
Bye.
Peter leaves in the knowledge that his cancer hasn't spread any further. Our hospital beds have given us intimate access to the work of the NHS. After a short stay on paediatric bed 27, Sonny's sore finger didn't stop him playing in his weekend tournament. Kenza spent 2 weeks in hospital before being discharged. Doctors are still hoping to avoid surgery on his spine. And Peter's undergoing chemotherapy for his prostate cancer and is already looking forward to when he can have a pint again. The beds are now back on their wards, ready and waiting for their next round of patients.